How do we treat protracted withdrawal? My name is Dr. Dutton. I'm a board-certified adult psychiatrist, and I talk a lot in this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And one of the things I talk about is how it's important that we use a hyperbolic taper approach in order to prevent things like protracted withdrawal. Now, I've done other videos where I go into more the details of protracted withdrawal, but essentially this is a condition that can affect almost every system of your body. It can be very debilitating for people. It's usually going to emerge after the acute withdrawal period. It could be weeks to months later, and it's not going to resolve when you reinstate the medication. So this is what differentiates it from acute withdrawal symptoms when we're talking about antidepressants. And the treatment may not be what you guys want to hear. There's basically no medication or no intervention that can hasten the process of recovery from protracted withdrawal. Of course, there can be little things that might be helpful for mitigating some of the side effects, but it's mostly a waiting game, which is really, really challenging. So it's a lot of supportive care, making sure that the individual has support from family, support from other, communities and networks in the withdrawal community, so that they can talk about what they're going through and pull from the experiences of others. It's important that they're connected with their mental health provider so that they can monitor them, both in terms of their symptoms, but to make sure that they're staying safe. Now, this is a huge thing because a lot of people going through protracted withdrawal are going to experience severe SI. And it's because of this brain injury. People who've never had SI before develop it, and it can be really difficult to live with. So a lot of the treatment plan is going to be safety planning, making sure that there's someone there with them, that they don't have the opportunity to act on those thoughts. And the next is going to be, you want to make sure you're not making it worse, which means not introducing other psychotropic or CNS active medications that could re-injure that individual and prolong the process of recovery. Now, there can be some medications that can help with some of these symptoms. Things like propranolol can be helpful for akathisia. I've had people tell me that mirtazapine or other sleep aids like melatonin or magnesium glycinate have been helpful for sleep. But it really depends on the individual. You have to be really cautious because for some people, if you reintroduce anything that's psychotropic or neuroactive, it can make it worse for them. So certainly proceed with caution if you're considering symptomatic treatment with other medications. And lastly, it's just a lot of reassurance because although this is a really long recovery, it does tend to get better for most people, but we're not talking about weeks to months, we're talking about years. And so it's providing that expectation that it may be a long haul, but that there is hope that it will get better. If there's other things that have been helpful for you on your recovery journey from protracted withdrawal, then I'd love to hear about it in the comments below, so please share. Also, I'm putting together an email list for those of you who are interested in my content because I may have future courses or offerings, and I want to be able to communicate directly with you all about those things. So if that's you, send me a DM with your email, and I'll see you in the next one.